Well, keeping an eye on your health, there's a very important event coming to Austin. It's called the Trauma and Critical Care Conference. And joining us today is one of the founders, Dr. Ben Coopwood. Thank you for joining us this morning.
Thanks for having me.
Absolutely. So the conference is May 31st through June 1st over at the AT&T Conference Center.
Yes, just up the street.
Talk about the event, who will be attending, and what topics you hope to cover.
Well, this is a conference in its current form. This will be the fourth year. We're lucky to have a venue like the AT&T Executive Conference Center to have it in. The conference is designed for all levels of healthcare providers that will take care of injured patients, from the pre-hospital provider, the allied health professionals, and the doctors and nurses that provide the team and the continuum to take care of these injured patients.
And why did you feel like it was important to kind of bring everyone together for this type of educational seminar?
Well, you know, the care of the injured patient is very, very complex, and to get optimum outcomes and ultimately save lives, it takes a dedicated team, multidisciplinary team effort. And conferences like this are able to bring all healthcare providers in one setting, and so everybody can get the latest information on how best to care for these patients.
When it comes to emergency care, caring for the critically ill, what are some of the successes that you've seen? What are some of the challenges?
Well, I guess from when I started, I've been back in Austin since 1995, and we've had kind of a revolution in pre-hospital care and our pre-hospital treatment, specifically about lowering transport times and some maneuvers that that the paramedics can do in the field regarding resuscitation or limiting resuscitation until they can get them to the hospital. And that's really improved and saved lives, getting the patients to the trauma centers very quickly. And then within the trauma center, the area of the critical care medicine and management of traumatic brain injuries is kind of the next frontier that we're working on to try to save lives.
And we've seen robotic surgery also kind of...
Yeah, robotic surgery is there. We have not found many applications yet in the care of the injured trauma patient, but I'm sure that will be coming on the horizon in the future.
How are the regional emergency care centers helping?
We're lucky in this region. We started in 1995 with a single level 2 center at UMCB just on 15th Street. Since we've expanded, we have 2 level 2 centers in Round Rock, Texas, and Dell Children's Center is the only level 1 pediatric trauma center in the region, and Brackenridge has stepped up and gone from level 2 to a level 1 center.
Now, would a teaching hospital, a medical school help matters even more for critical care?
Oh, no question about that. The facility that we're currently in was built in 1974, so you can imagine with the technology over the last 30, 40 years, it's very, very small. And our commitment to educating our future caregivers has just grown. So we've really run out of space. So the fact that we're going to hopefully replace UMCB with a state-of-the-art larger hospital is just a godsend for the community. And then on top of that, the possibility of having a medical school in Austin is just going to ultimately increase the care for all the citizens and allow us to get world-class care in our local community.
Well, we want to thank you for joining us again, the Trauma and Critical Care Conference at the AT&T Conference Center, May 31st through June 1st. Thank you so much for being with us this morning.